Hello everyone. Today my presentation will be looking at my examination about the impact of labors on social isolation of older Chinese immigrants living alone during the COVID-19 pandemic. The number of senior immigrants increased rapidly and continually from 2015 to 2019 in Alberta. Chinese seniors are one of the top 3 racialized older adult community in Calgary. Social isolation is a key concern for them because of prevalence of disability, risk factor of living alone, having low income, being single, experience loss, and having transportation difficulties. Also, 63% of immigrant senior who were unable to speak either official language, English or French. So cultural and language barrier are a higher reliance on Chinese cultural values to make the Chinese older adult would have a greater likelihood of isolations. I was also surprised to know that 1 in 4 older Chinese adults are likely to experience depressions. That is much higher than that report 10 to 15% in general elderly populations. During the COVID, older adults suffer more from isolation as they feel more unsafe than younger people. They also have less technological and internet engagement, which affect their ability to socialize and gather important information. Racism against Asians also intensified experience of social isolation among older Chinese immigrants. I draw the work of 2 scholars, Grander and Melville. They find that neighborhoods are most important and influence for aging. So, my research question is, how do labor impact the social isolations of older Chinese immigrants during the pandemic? For my research method, I have conducted 4 individual semi-structured interviews and 2 focus groups for target participants who are age 65 and older, living either alone or live with a partner in a senior independent living in Chinatown community. They are self-identified as a Chinese immigrant. I recruit them from a senior independent living building. Here are the questions I asked in the interview. There is 10 questions. Finding. There are 4 major findings. First, the relationship among neighbor enhanced and improved during the COVID. Second, neighbors have been taking over the role as helper for senior to complete daily tasks. Third, neighborhood is Chinese senior concerned to improve and cultivating a more age-friendly community. The last one is technology cannot be paid to support from neighbors, although it can help their social connections. Conclusions. Neighbor has been crucial in supporting the senior, especially for their social and emotional support during the pandemic. Neighborhood support is also an essential part for cultivating a more age-friendly community. Further discussion about the way to mobilize labor as valuable community resources are needed. Also, the factor in making neighbors associate with positive impact can be a further study. This study is limited to connect the data from 1 senior independent living building. The finding can be explored to connect the participants who live in various types of housing. Acknowledgements. Before the end of the presentation, I would like to take a moment to thank my amazing supervisor, Dr. Elian Ferry, for his support and encouragement, and U of C Pure Program and All Quant Foundation. Thank you for your listening. If you have further questions, please contact me by the email. Thank you.